Let's get straight to the practice question. A cardiologist performs a complete TTE, that is transthoracic echocardiogram. Let's get straight to practice. A cardiologist performs a complete transthoracic echocardiogram with spectral and color Doppler on a patient with suspected mitral valve prolapse. What code should be assigned here? If you're new to my channel, I help medical coders onto various things from certification to working. Please subscribe to this channel. Also, leave a like, helps me a lot. It does. It actually does. You got 4 to 5 minutes to answer these questions within the options. Please refer to your CPT book. And yeah, if you have already got the answer, why not move ahead, skip to next to third 3 to 4 minutes, and there you go. I'll be telling you the answer. All right, time to answer this question. If you have not got the answer, please pause the video. The answer to this question is option A, that is 93306, which actually represents the TTE, that is trans thoracic echocardiogram. Moving on to next question. An outpatient undergoes a cardiovascular stress test using a motorized treadmill. The physician supervises the test, interprets the continuous tracking, and authors the final report. The equipment is owned by the imaging center, and what code is billed by the physician or to the physician? All right, time to answer the question. The answer to this question number 32 is B, that is 9301. No, sorry, it's option B, that is option with the codes 93016 and 18. Why is that? Because we are billing it for physical supervision along with interpretation and report. All right, moving on to next question. I have few doubts, so yeah, I'll cross check that as well. Also, you can leave feedback in the comment section if at all you think I have got something wrong. Do let me know as well. Uh, yeah, I'll see what exactly went wrong with my answer there. Um, this question, a patient with dual chamber pacemaker undergoes as in-person electronic interrogation device evaluation of the pacemaker channels. The technician tracks the battery life, pacing thresholds, and lead program values, which are subsequently reviewed and signed off by the cardiologist. What code is appropriate here? All right, time to answer this question. The answer to this question is option A, that is 93280. All right. Why? Because this in-person electronic integration device evaluation of this particular pacemaker with analysis of these parameters and lead function is described in this code. Moving on to next question, a duplex scan of the bilateral extracranial cerebrovascular system is ordered and executed. What is the correct CPT code for this particular selection? All right. Time to answer the question. Question number 34. The answer is option A. It is rated 0 as it describes a duplex scan of this particular extracranial artery. Moving on to next question. Question number 5. A patient with chronic swelling of the left lower extremity is sent for a duplex scan of the deep and superficial veins to rule out DVT. The scan is limited to the left leg, and what is the code reported here? All right, time to answer this question. The answer to this question number 35 is B. I've also mentioned C. It's depending upon the pair specific policy. So 970 is for a complete bilateral study of lower extremity veins. However, 971 represents a unilateral limited study. Modifiers like LT can be added to specify the left leg, but code 971 is the core driver. So option C, yeah, obviously everybody's got to go with option C. But 970 is for a complete bilateral study, and you know what I'm talking about. So option B or option C. You will either go with LT if the pair meets the specific modifier, or without the LT modifier, specifying the left side that was done. All right. Next, going on to question number 36. A complete spirometry test is performed before and after the administration of an bronchodilator in a pulmonary function clinic. What is the most accurate code to be coded here? All right, time to answer the question. Answer to this question number 36 is option B, that is 94060, as it covers complete. All right, moving on to question number 7. A pulmonologist performs a carbon monoxide diffusing capacity test alongside a functional residual capacity plethysmography lung volume study. How should these separate tests be reported? Time to answer this question. The answer to this question is option A. That is reported. It is reported with 726 and 729 as an add-on code. Moving on to eighth question. A pediatric patient undergoes percutaneous skin allergy testing with allergenic extracts for 24 separate allergens. The physician performs the punctures and interprets the wheeler responses. How should this be built? Should be one that can get you, or you might be getting this answer within few seconds. Also, yeah, reminder to you guys, do let me know in the comments what do you feel about this question set. If at all, yeah, if you are looking for something in particular to practice, do let me know that as well. Also, reminder again to like and subscribe as always. Answer to this question is option B, that is 004 with 24 units to be built. Moving on to second last question, a 35-year-old patient receives an initial injection of an allergenic extract for environmental allergies. The extract is provided by the patient's primary allergist, but the injection is performed by an outside clinic nurse. The service consists of a single injection. What code is built by the outside clinic? All right. Answer to this question number nine is option A, that is 95115. All right. Moving on to last question. Again, a reminder for you to what and comment. All right. The last question, a patient undergoes a 24-hour continuous video EEG, recording with professional monitoring of the data stream. A technical setup, continuous recording, and takedown are handled by a facility technician. The neurologist provides the ultimate review, interpretation, and final report. What code should the neurologist report? All right, if you have not got the answer, please pause the video. I'm going to tell you the answer to this question. For answer to this question number 10 is option A, that is neurologist performs interpretation lasting 24 hours is reported under 720. All right, thanks for watching this. My name is Harshal, and you know what to do. Uh, I help you, you help me. That's what we'll do. All right. Thanks for watching this one. My name is Harshal. This is Decode Healthcare with Harshal, and I'll see you in the next one. Till then, happy coding.